Good morning. Thank you for joining us this morning for this webinar on the role of alcohol in gendered violence and violence against children. I'd like to start by acknowledging that I'm joining from the lands of Ngunnawal and Ngambri people and to pay my respect to elders past and present. And I invite you to mention in the comment box where you're joining us from today. I'd also like to acknowledge the many Aboriginal and Torres Strait Islander women who are leading change to improve the health, wellbeing and safety of their families and communities. I want to recognise the tireless advocacy of survivor advocates and people working in the community sector who have themselves experienced and seen violence, who have supported people who've experienced violence and who turn up every day to make a difference. I want to acknowledge those of you who are here in this virtual room today who do this important work. My name's Caterina and I'm part of the team at the Foundation for Alcohol Research and Education, or FARE. FARE is a not-for-profit organisation with a vision for an Australia free from alcohol harms, where communities are healthy and well, and where laws, policies and programs are fair, equitable and just. Every day, people across Australia are negatively impacted by alcohol, including through injury, violence, mental ill health, chronic disease and disadvantage. By working together, we can change this. We work collaboratively to build the capacity of people wanting to create change. We raise community awareness of the harms that alcohol causes. We advocate for policy change that will lead to the prevention of alcohol harms and increase the accountability of companies that fuel harms. This webinar today focuses on one of the commercial drivers of violence, alcohol. This morning, you will hear from Survivor Advocate Kym Valentine and researchers Dr Ingrid Wilson, Nicole Hewlett and Professor Michael Salter. I want to thank each of our speakers for being part of today's event. In Australia, alcohol is estimated to be involved in between 23 and 65% of all family violence incidents reported to police, depending on the state in which you live. Nearly half, or 47% of all women who've experienced sexual assault by a man in the past 10 years believe that alcohol or another substance contributed to their most recent incident. In 2021-22, 20% of homicide offenders had used alcohol. There are many more statistics like these. I've worked at this organisation in two parts for more than a decade across 15 years. Over this time, people have shared with me how they knew as a child when their father was drunk that it was their sign to find a place to hide. Women have shared with me that the sound of their drunk partner returning home or of the delivery truck is the prompt for them to enact their safety plans to keep their kids safe. Far too many women have shared with me that they were sexually assaulted in nightclubs or on university campuses and that alcohol was involved. People working in women's services have shared with me how they brace themselves on nights that involve lots of alcohol, like football grand finals. Despite all of this, measures targeting the role of alcohol in violence prevention have largely been absent. The reluctance to talk about alcohol not only invalidates the lived experience of these survivors, but creates policy paralysis in an area that has been neglected for too long. Today, we are creating this space in this webinar to discuss the role of alcohol, a space for us to come together, seek to understand and ask, what more can governments be doing to address this? If we are to prevent further harm, if we are actually serious about this, if governments are going to do all they can, we must be unafraid to speak freely about all the factors that contribute to this violence. Everything needs to be on the table. I'd like to start by inviting our first speaker, Kym Valentine. Kym is a survivor advocate. Kym works with Safe and Equal as a facilitator, advisor and wellbeing coordinator and lived experience research officer. She's also a lived experience advisor to FARE. She was previously a member and chair of the Victorian Government's Victim Survivor Advisory Council. Thank you, Kym.
I would also like to start by expressing my gratitude to Michaela Cronin and her recent remarks in recognising that we need to better regulate harmful industries like alcohol, and to the Prime Minister, Anthony Albanese. This is incredible progress that we've made recently. And thanks to the Australian Premiers and Chief Ministers as well, who have all committed to reviewing their liquor laws and sharing best practice. Kat and I personally look forward to working with all of these people and helping them to do just that. And hopefully we can have the safety of women and children centred when it comes to reform. I'd like to thank all of those who are attending today. Thank you for coming here today to listen to us with an open heart and an open mind. And if there is anything that you hear today that strikes a chord with you, I invite you to help us on this campaign to centre women and children and harm reduction in general in policy reform. I'll put a link to the FAIR website and also the Violence Against Women and Children campaign that we've been working on. And most importantly, I would like to acknowledge all of the victim survivors who are here today, and in particular those who have lost a loved one to family violence. It's for them that we do this work. So yes, I am a survivor advocate and I represent the voice of lived experience, but I'm under no illusions. I could never represent all voices. But as a survivor advocate, I've heard so many stories of harm. Everyone's story is unique, but there are commonalities. There are common threads and there are immediate levers that we can access to address each of these, including alcohol. And for far too long, it has been politically controversial to take action on alcohol, despite the fact that the link between alcohol and violence has always been categorically undeniable. For victim survivors and children, this is a critical moment in time, and our real-life experiences cannot be ignored, suppressed, or denied anymore. We all know that alcohol is an accelerant, that it exacerbates and increases the prevalence and the severity of domestic, family, and sexual violence. And for victim survivors, this is unequivocal. Victim survivors know only too well that the sound of the alcohol delivery car pulling up in the driveway is a signal to enact a safety plan. For so many victim survivors, they will tell you how they fear their safety more after the sun goes down, and particularly when their abuser has been drinking. And we've always known that when drinking is involved, it's like pouring petrol on a bonfire. We have the evidence, we have the research, we have the data that supports this. But for most of us out in the world, it is just common sense. We all know alcohol increases the frequency and the severity of risk and of harm. So access to alcohol recently has drastically increased. So the more access equals more harm. And yet our liquor laws have remained mainly unchanged for decades. Victim survivors, and most importantly, children should not have to mitigate this influx of alcohol into our homes. We have been saying it for years, and we shouldn't have to keep saying it because we know that addressing its role is an important way to reduce harm. And yet, in the attempt to confront this national emergency and prevent further harm to women and children, alcohol until now has been blatantly ignored. And as such, so will we. We often hear from adults, but we rarely hear from the most important voice in this conversation, and that is the children that are hiding under beds, hiding in closets and bathrooms, hearing furniture thrown, yelling and screaming, glass breaking. They know. Children who don't have a choice and they don't have a voice. Now, I'll give you a heads up. This might be a little bit confronting, but I think it is really important that we hear from one little girl. I'm going to speak on her behalf right now. The yelling, the screaming, the sound of glass shattering. There's no money again, no dinner again tonight, no peace again tonight. Just terror, just constant threat. Only the threat level changes. Perpetually holding her breath, hiding under beds, in closets, being thrown over the fence to the next door neighbour in the middle of the night and being told, run. Huddling with her brother in the bathroom, holding each other in the bathtub. They're crying, but they're trying to cry silent. terrified, knowing all too well what others have as safety is for us only violence and constant threat. No respite, no refuge, no safety. Only sudden warnings, indicators, adapters, and then panic stations. Not knowing what to expect, and yet the one sure thing was when he started drinking, there is only one outcome: more fear, more violence, more certain it's only going to get worse. We will all be at the mercy, in a constant state of cat-like readiness, fight, flight, freeze, fawn, whatever we come to call it. But now the only word, the only reality is fear. Pure white fear, a real life terrifying minefield. Tiptoeing, not sure which toe, but just don't set the bomb off. All of our energy, all of our focus is narrowed down to that: bombs and navigating the minefield. As adults, it's their minefield to navigate. It's the adult's duty to remove any and all mines, or at least one of them. Kids are living in the trenches, and relief is delayed while the grown-ups debate, while the grown-ups have the battle of the bombs. While the adults debate and discuss, more mines, more bombs have been detonated, and another and another and another and another, and a constant explosion, because everything that causes harm or increases harm is a bomb. Drugs are a bomb. Gambling is a bomb. Mental health is a bomb. Pornography is a bomb. Trauma is a bomb. Poverty is a bomb. Alcohol is a bomb. Gender inequality is a bomb. All bombs harm. All bombs individually and interconnected are harmful, and all harm is important. We are telling you, this is a bomb, this is hurting us, this is harmful, and all harm hurts. So please believe us when we tell you that alcohol is a bomb. Believe us when we tell you this is hurting us. This is intensifying our experience of violence. That little girl hiding under her bed, her intoxicated parental abuser, a bomb, is banging on her bedroom door. The Uber delivery man, a directed missile, is pulling into the driveway with more ammunition. What do we do? Do we not intercept it? What do we tell her? What do we tell that girl? We know you're scared and we could try to help you, but we're currently busy with other bombs at the moment. We'll plan on getting back to you about that missile currently hurtling towards you, hopefully by the next generation. Children living in fear right now, right here in this moment, in their own homes, they deserve a sense of urgency to keep them safe. Every child who has lived or is still living with that reality of that fear, they don't care about the politics. Every child who doesn't have a voice and doesn't have a choice are begging you, if it harms us, we need the adults to help put it out, because children have rights and we as adults have responsibilities. And there are some simple actions that state and federal governments can take, which would help to make women and children immediately safer within their homes. And we've seen governments act swiftly in the past to improve public safety and crack down on alcohol-related violence. And what we're asking for right now are relatively modest changes, but changes that would play a huge part in reducing the rate and the severity of family violence. The overarching philosophy is to believe victims, embed lived experience, be inclusive of all experience, and our experiences are the facts. Lived experience cannot be denied. Ideology and theory cannot exclude, devalue, reject our very, very real and overwhelmingly common experiences. So the message from this victim survivor is pretty clear. Believing us is the strategy. No one denies this is a very complex issue, but it does not need to be any more complicated than it already is. At the end of the day, we all want the same outcome, but we can only get there together. We must pull every lever, do all the things, anything, everything we can, all at once, if we really want to affect generational change. And if there is any lever in reach, it is incumbent upon us to pull it, because this is a national emergency. It is a national crisis. If you can see a lever, if you can reach a lever, then for the love of God, pull it. Because we don't have a second to waste. Our lives are literally depending on it. And if you can reach a lever and you don't attempt to pull it, then there is a little girl that I would like to introduce you to. She is one of far too many who will deserve an explanation. Thank you.
Thank you so much, Kym. Kym, I do want to stop for a second just to thank you for your advocacy and for sharing these experiences in the hope that things will change. I'm very grateful for you being involved in this and, you know, being part of the broader FAIR team and community and advocating for change. Thanks so much, mate. I'd now like to invite Dr. Ingrid Wilson to speak. Ingrid is an assistant professor at the Singapore Institute of Technology and honorary research fellow at the Judith Lumley Centre at the La Trobe University. Her research explores opportunities to reduce alcohol-related intimate partner violence, drawing on the experience of women survivors. She's the founder of the La Trobe University ReGen, Reducing Gender-Based Violence Network. Ingrid's been undertaking research in this area for a really long time, and I'm really grateful, Ingrid, that you're here today to share some of this research with people who are joining us.
Thanks, Caterina, for the opportunity to take part in this discussion, and thanks, Kym, for sharing your experience in such a courageous way. So, yes, my interest in this area has very much been about elevating the voices of lived experience. And I came to this topic, sometime back. I'd always had a strong interest in gender-based violence, and had also spent some time in the alcohol policy space. And as a feminist researcher, I was always curious about the sensitivities around alcohol's role as a risk factor, even despite the fact of there being such consistent evidence that it does contribute to making things worse, particularly like men's drinking makes things worse for women. So I do take a very strong gendered approach to this work. But what I thought was really missing in this space is, yes, where does the perspective of the female victim survivors come through? So that's what I'm going to share with you today. I'm going to share as an overview of the qualitative research. We have a plethora of quantitative research in this space telling us about this link, but often the humans behind those numbers get lost. So I'm going to share with you some of my research to really depict what women have told us about the drinking and violent episode. I'm also going to share about the relationship trajectory. So how do women kind of navigate their relationships over that whole trajectory where their partner has a problem with alcohol and is also violent towards them and their children. And then lastly, I'm going to talk about a review that we published this year of qualitative research globally, which really does shed light on the broad impact that men's drinking does have on women's lives. So just a little bit about my research. I used grounded theory to really uncover the nuances and the conceptual aspects of this experience. Importantly, I drew from a community sample. A lot of the research in this space draws from clinical samples of where particularly spouses of men who have had long-term problems. So these women have also not been engaged with formal services, and so didn't really necessarily identify as victim survivors of intimate partner violence. We asked the question of, have you ever felt afraid when your partner's drinking? And I think that's important for people to self-define what makes them afraid. So this is the conceptual representation of what women talk to me about. So my analysis of the interviews overall revealed that violence was experienced as a cycle that was intimately connected to recognized stages of their partner's drinking. So these women described with quite chilling precision how their partner might start drinking. He'd be fun and loving at the start of the drinking cycle and then become increasingly aggressive and targeted towards her the more intoxicated he became. And you can see from this quote how this participant really described these stages in quite a clear way. Now, the worst stage of the switch or the flip, it didn't happen every time, but it happened enough for people to feel afraid every time he started drinking. And importantly, women talked about these stages as being, oh, that's the safe stage, or that's the unsafe stage. And so the fact that this happened enough meant that every time he picked up the bottle, as Kym mentioned, every time the drinking started, women didn't know if it was going to escalate to that worst stage each time, but they had to prepare for that. What I also did was I mapped onto this cycle the range of strategies that women use to manage their own and the safety of their children during the drinking and abuse cycle. And I categorised these as preventing. So women did everything that they could to stop it from happening in the first place. They poured out alcohol. They managed routines so that he wouldn't go into the same pattern of getting home, starting drinking. Some women even talked about they would have sex with their partner to get him to sleep and disrupt some of these routines, anything to do so that they could stop him from drinking. But also predicting was another safety strategy. These women knew to watch their partners and observe all the signs, and they knew when it was going to happen. So that constant vigilance was a part of this safety strategy. During that time of when he was moving towards the baiting and the provocation, some women talked about different strategies that they would respond and fight back, where especially when there was challenges or jealous accusations with no basis behind them. For some women it was they would respond, but then they also knew that was incredibly dangerous strategy too. So women talked about responding in really tactical passivity, I called it, but it was a very conscious decision. But when situations were at their worst, women went into lockdown. They really had to take every measure, the measures that Kym described, to actually keep everyone safe. Now, one of the interesting things that women talked about, especially where their partners had real serious alcohol problems, was that during this dangerous cycle, they were still conscious of looking after the partner, going back to check when he's passed out, checking that he was still breathing. They also had this sense of responsibility because the children could see their father passed out and the children were worried. So can you imagine what that does to your sense of self, having to both protect yourself from a loved partner who is incredibly violent towards you and your children, but then having to also be that caregiver in the moment? And I think one of the important things too is that this cycle came to an end, but then it really did mess with women's heads, where they had to then pretend that life was normal at the end of this episode. And often the partner either couldn't remember, was in denial that it happened, or there was absolute silence. So I've just included a few quotes here from some of the women that really help to describe this cycle and their reactions and what they do to keep themselves safe. So I'll just move on now to how women connect drinking and violence over the relationship trajectory. And this image is in the published piece that we published in I think it was 2020. Okay, so one of the things that when women were talking about their experience of alcohol-related intimate partner violence, we talked about the relationship. And one of the characteristics was at the start of the relationship where things are in the honeymoon stage, this understanding of a partner's problematic drinking, it was really hard to detect because we're in a society where heavy drinking is quite normalized. Often couples are drinking together, and women talked about they really couldn't see it. And also, even when there were signs, it was really hard to see it as anything but normal, which really speaks to that culture of celebrating heavy drinking as a marker of masculinity. But then it was when, as relationships become established, women are cohabiting, forming families, that's when they can really start to see where problematic drinking plays out, and as well starting to impact on the family life. And one of the challenges for women in this situation then is that when they start to question his drinking, it also becomes dangerous. And that's again speaks to this culture where it really is, we're not able to question a man's drinking, even when it's creating some obvious harm. So you can see this, I've also highlighted where women actually do all they can to navigate his drinking and also trying to get him to seek help. But certainly what women commonly said is that there was this absolute resistance to change, even despite evidence of his drinking causing harm. And really the catalyst for women to leave, like they come and they go several times, is when it comes down to they know they're going to be very harmed, as well as their children being harmed. And they realise the impact also of the drinking on their children. So one of the important things, and I think this is really important for service providers to also understand, is that this experience of alcohol-related intimate partner violence has such a long-lasting effect. And one of the key things is that alcohol, being around alcohol in our culture, is actually the trigger that women talk about. So even when they're navigating new relationships or trying to, establish a new normal for themselves away from this relationship, the fact that being around alcohol re-triggers women and reignites their trauma. And even in new relationships where their partners don't drink, women, as highlighted in that quote there from Carla, 5 years on now, I'm still waiting for the moment when the new partner becomes drunk and angry, and she talks about her and her children as being damaged goods. So you can see in these relationships, there's a lot of potential for intervention. I'll just go on just finally to talk about this review that we did. We looked at the global literature over a significant amount of time to understand, to look at first studies that touch on men's drinking and intimate partner violence. And as we said, focusing on the qualitative research gives women's perspectives. We wanted to know more about what is the harm that they experience. And just, this looks like a bit of a complicated diagram, but what it speaks to is the range of ways that women are directly and indirectly harmed by men's drinking. And I'll go into that a little bit more. So what I'm just going to do is pull out a few of the quotes from women's voices from this review that really highlight the significant impact that men's drinking and aggression has on women. So one of the things that we actually don't hear enough about is the fact that men's drinking, men behave in quite sexually aggressive ways, as these women talked about, when he's been drinking. And one of the challenges there is, we have unwanted pregnancy, women's ability to negotiate safe sex, reduce STIs, etc. Women, they do talk about, as highlighted in this quote, when a partner is drunk, it's really, really difficult to be able to push back. Another thing that we don't see and is not talked about is how much men's drinking disempowers women economically. We have more research now about economic abuse. I've looked at that research, and rarely do they talk about alcohol as one of those areas in which women are economically disempowered. So the idea that men are spending the household income on their drinking is something that's such a common thing that women talked about in the interviews that I did, as well as in this review. And as well, women have to carry the burden of caregiving, especially when a partner's alcohol problems affect his ability to work, etc. And in low-income settings, women also talked about having to engage in other activities which put them at risk, such as what they call survival sex, in order to make sure that they've got enough income. And there's other aspects in ways, again, that we really don't see, where men's drinking contributes to marital disharmony, also affects women's ability to interact socially. There's so much isolation and shame. And I think it's really important for us to understand that women who experience alcohol-related intimate partner violence, they face double stigma. Already they've got the shame of experiencing violence, but they've also got the shame of having a partner with alcohol problems. So you can see how men's alcohol use really does contribute to some indirect harms over and above the physical aggression that we do know about from the quantitative research. So just echoing what Kym was saying, women are telling us that their partner's drinking has an insidious effect on their lives. And as highlighted by that cycle, alcohol and violence for these women are absolutely intertwined, affecting their sense of safety. And as Robin Room talked about, the mere threat to go drinking acquires the power that a raised stick would have. So if you think about our culture where drinking is so entrenched, the fact of someone going off to the football where we know that drinking's there does, elevate women's vigilance and sense of anticipation. Is it going to be one of those times now? So really, we do actually need to engage in the complexity and also take a gendered perspective on men's drinking and harms to women. We do absolutely risk gaslighting women and children by not believing them when they tell us that alcohol makes a difference in their lives. And we need to start to think about interventions that address men's problematic drinking so that we can also support women and children to stop that cycle of drinking and violence. And we need to involve the women with lived experience in designing those interventions. So thank you.
Thank you so much for sharing that, Ingrid. And I just want to thank you for all of the work that you've done in engaging with women and seeking to understand their experiences, and particularly at a time when this type of research wasn't welcomed. So thank you for doing all of this work and for communicating it here today. I want to now invite Nicole Hewlett to speak. So Nick is a proud Palawa woman, a PhD candidate who holds 2 positions at the University of Queensland, one as a project manager in the First Nations Cancer and Research Wellbeing Program, and the other is a fetal alcohol spectrum disorder researcher in the Child Health Research Centre. Nicole has extensive experience in and is passionate about translating culturally responsive frameworks, healing-informed approaches and wellbeing models into a range of different practice settings to create equitable access to knowledge, services and supports among Aboriginal and Torres Strait Islander peoples. And thank you so much for joining us today, Nick.
Thanks, Kat and Ingrid and Kym for sharing both your stories and the research, because it does both of them tell quite a powerful story that, resonates quite strongly. As Kat said, I do largely work in knowledge translation around fetal alcohol spectrum disorder. And where there is unrecognised FASD, there are people with unsupported FASD, which means there is generally violence, regardless of your identity, culture, or skin colour. But for our people, we cannot talk about violence or alcohol without talking about, the backdrop in which it sits, which is colonisation and its ongoing and insidious impacts. Violence, as you probably all know, it was introduced to this country, and the cruelest kinds of violence was perpetuated against our bodies, our minds, and of course our spirits. And you only really need to look around at the violence that has been done, to these lands and these waters to understand that humanity itself has an issue with violence. And we're raising generation after generation saturated in it. The alcohol industry, of course, knows this, and they know that there are cycles of profit to be made from cycles of trauma that has been a product of that violence. And as Kym and both Ingrid touched on, children are most affected, and children are life. They are, they are pure spirit, or muyini, as we call it here in the Twitter. And children aren't born violent. That's something we learn, and we internalize it. And then how do we cope with such disturbance in our beings? We consume alcohol for many people to soothe that deep pain that accompanies such disturbance. And then, that internalized violence becomes externalized, and and their cycles become, perpetuated and exacerbated. And that externalization of that violence, obviously, is everything that Ingrid and Kym were talking about. And our people know this, and we understand also that without healing and without a family approach to healing, there will be no stop to that violence. And this healing-informed approach, often underpins the programs, which is why our community-led initiatives have shown, time and time again to be so effective. And one example is in the Fitzroy Valley, led by June Oscar and Emily Carter and many other very incredible leaders who came together in solidarity to address both unrecognised and therefore unsupported FASD and the alcohol harm and violence, suicides especially, actually, that comes with that in the Fitzroy Valley in WA. And they've been and continue to be incredibly successful, but they needed to genuinely lead and, even more importantly, govern the work, to have complete power to say who should be involved and how they should be involved, where the government should provide resources, but not micromanage at how those resources should be used. And the community was supported to implement, their own solutions, which means they drew on their strengths of culture and their sovereignty to apply a healing-informed approach. And you cannot support healing, anything unless you do so holistically. So in the Fitzroy, they had things like community-imposed restrictions, which has very different outcomes when it's asked for by community and self-determined by community, as opposed to imposed by the government. They had strong, meaningful partnerships and with social services, police, lawyers, clinicians, schools, businesses, you name it. And this coordinated approach meant community members had access to supports that meaningfully met their needs, whether they be diagnosed with FASD or not. And they continue to heal, to this very day, despite the ever-changing policies and programs of the government. And in times where the government resourcing has been scarce or fragile, this community still bands together and still gets on with the job and finds a way to continue, such as the strength of our communities. But they really shouldn't have to, especially much for governments and the wider society to learn from our people. But I want to echo also and build on what Ingrid and Kym said around, when you go to those living the experience, only they can tell you what the truth is. But you also need to build trust with those that have never been shown, kindness perhaps throughout their life. And truth and trust go hands in hand. So unless we build, their trust by listening to them and their truth, we're not going to be able to respond to it effectively. But I'll just my mousse for now and wait to complete my soapbox talks during the panel.
Thank you, Nick. And I want to thank you so much for joining today, Nick. Nick is actually on leave and she really wanted to be part of this and so made it happen. And we're very grateful for that, Nick, and looking forward to hearing more from you on the panel. Okay, I'd now like to invite our final speaker before we go into that panel discussion. And our final speaker is Professor Michael Salter. So Michael is the Director of Childlight UNSW, the Australasian Hub of Childlight, the Global Child Safety Institute, which undertakes research for impact on child sexual abuse and exploitation. Michael is Chair of the Grace Tame Foundation. He's a member of a number of advisory groups, including the Advisory Group of the National Plan to Prevent Violence Against Women and Their Children, the Expert Advisory Group of the E-Safety Commissioner, and the Expert Advisory Committee of the Canadian Centre for Child Protection. Thanks for joining us today, Michael.
Thanks for having me, Kat. It's a real privilege just to be here with such incredible advocates and researchers. So thanks also to Nick and Ingrid and Kym. I first came to the study of alcohol-related harm and its intersection with trauma and violence about 15 years ago. In the child abuse sector, we were talking a lot about the ways in which survivors sometimes use alcohol and other drugs in order to self-medicate, recognizing that a lot of survivors just don't have access to effective and affordable mental health care and other sorts of services. And so we conducted a study starting in 2008, actually, where we were interviewing adult women who had a history of child sexual abuse, who had been through alcohol and drug treatment in New South Wales. And we were also interviewing alcohol and drug service providers and workers about their experience and their practice with female clients who'd been sexually abused. And over the course of the interviews, every woman who we interviewed hadn't just been sexually abused. Every woman that we'd interviewed had a recent history of domestic violence. It was pretty common that they were currently in an abusive relationship. And that was really mirrored by the alcohol and drug workers who talked about, the fact that most of their clients, if they were coming into detox or rehab, their female clients were being subject to domestic violence at the time of treatment. And it really signaled a point that I think that Nick and Ingrid and Kym have made so clearly, which is that, as academics and in the policy space, we can talk in these very abstract ways about risk factors, and we can have these very academic debates about what is a driver and what is a risk factor and what is a contributor and what is a reinforcing factor. But for victims and survivors and their kids and for workers, it's not abstract, and it's not so easy to sort of pull apart all of the complexity that keeps people sometimes trapped in abusive situations or abusive systems. Over the course of, my career, after this particular research project, one of the things that we were advocating from based on that research project was the importance of gender-sensitive alcohol and drug treatment, because for women in alcohol and drug services, their needs were quite different. They had trauma, they were often, as I mentioned, being subject to domestic violence, but they were also the primary caregiver of their kids. But they were in a system that was actually built for men, because men have the majority of alcohol and drug problems. And so the service system was ostensibly gender blind, but it actually wasn't gender blind. The service system as we were dealing with it 15 years ago, was really built for a male client, and women were really struggling. They were subject to intersecting, sometimes family court and child protection prerogatives. You know, they had to pass certain standards to keep their kids, but they weren't being supported around their parenting. So we really wanted to advocate for gender sensitive alcohol and drug treatment and services, recognizing also that a disproportionate group of men in alcohol and drug treatment are actually at, you know, there's a denser proportion of male perpetrators of family and domestic violence in alcohol and drug services than in the general community. So there's also then an opportunity to intervene and to reduce their risk and support behaviour change. However, as Australia's gone about building our architecture around the prevention of family, domestic and sexual violence, the role of alcohol in family, domestic and sexual violence hasn't just been marginalised, it's been contested. To the present day, we continue to see violence prevention agencies putting out messages actually questioning whether or not alcohol has a significant role to play in the prevention of gender-based violence. When I talk about these issues, when I talk about the role of alcohol in gender-based violence, often people's concern is, and what I often hear is that we risk, quote, degendering violence. So something that I really want to underscore this morning is violence is gendered. Men commit the majority of violence, but violence is not the only thing that is gendered. Alcohol is gendered. So globally and in Australia, men are more likely than women to drink. Men who do drink on average more alcohol than women do. Men are more likely to develop alcohol problems and problematic drinking than women. Men are actually 3 times more likely to die from alcohol-related causes than women. Women who have an alcohol problem are particularly likely to develop that problem in a relationship with a man who already has an alcohol problem. So this is a common pattern for women as they develop an alcohol problem. It, in a sense, comes about because of their intimate relationship. Women suffer greater levels of alcohol-related, health-related harm at lower levels of consumption than men. So when women are drinking at problematic levels, actually the impact on them physically and psychologically is worse than men who are drinking at equivalent rates. Women experience disproportionate levels of violence from partners who drink. So at the relationship level, if a man has an alcohol problem, this is a major risk factor for family, domestic and sexual violence. It's therefore unsurprising that women as a group are much more likely than men to support alcohol regulation policies and to support alcohol control. And in fact, this has been evident historically when we look at first wave feminism in the late 19th and early 20th century. It overlapped considerably with the temperance movement because first wave feminists drew a clear line between alcoholism, family violence, and also the family destitution that Ingrid was referring to, and the way in which alcohol can keep families trapped in a cycle of poverty. So, of course, these factors play out across axes of difference. And Nick has talked about how the impact of colonisation in Australia, but globally, places Indigenous and First Nations peoples at increased risk of alcohol disorders and alcohol-related harm. And this is quite actively capitalised upon by the alcohol industry, who will fight in order to deliver alcohol-related service into communities that they know are vulnerable. It's also true, for example, that LGBTQ people consume more alcohol on average than their cisgendered heterosexual counterparts. And then that potentially plays a role in domestic and sexual violence in sexual minority communities. What I want to emphasize in terms of alcohol consumption is that it's influenced by, I think, 4 key factors. So we have cultural and social norms, which is important, but there's also the acceptability of alcohol. And this is really about how alcohol is marketed. There's the availability of alcohol. which is around regulation and licensing. Government largely controls those levers. And then the affordability of alcohol, which is also linked to alcohol unit pricing. Over the last 10 years, when Australian violence prevention agencies have been talking about the link between alcohol and gender-based violence, they've focused on the first factor. So they've focused on cultural and social norms, problematic cultures of drinking, which is a problem. However, they've neglected the other three. It's also worth recognising that in 2008, when Australia was grappling with alcohol-related male violence against other men in terms of one-punch killings on the street, and the decision to reduce that, there was agreement across the states and territories to look at the affordability of alcohol and actually increase the unit price of alcohol. The response of the Australian alcohol lobby was actually to bring in an overseas academic who toured the country claiming that alcohol was not the problem was masculinity, the problem was toxic masculinity, that governments don't need to do anything to regulate the alcohol industry, they just needed to target problematic social and cultural norms. And something that I would put to the audience of the webinar is that if, as a responsible prevention or public health agency, we find ourselves mimicking the same rhetorical strategies as the alcohol industry, there's probably reason to sit back and reflect. So cultural and social norms are an issue, cultures of masculinity are an issue, but we also need to think about the acceptability of alcohol, the availability of alcohol, and the affordability of alcohol. The other point that I will make is that when it comes to gendered stereotypes and gendered social and cultural norms, the alcohol industry is very active in shaping those. Alcohol marketing is intensely gendered and it plays on gendered stereotypes. And frankly, their marketing budget to sell alcohol far dwarfs any funding that we will ever get from the government in order to change gendered norms and attitudes. We are swimming upstream, even if we just think about social and cultural norms, because we are operating against just the rivers of gold that the alcohol sector has to play with. So really just in closing, despite the very gendered nature of alcohol consumption, the gendered nature of alcohol marketing, the gendered nature of alcohol-related harm, which includes its contribution to family, domestic, and sexual violence, alcohol regulation and control policies in Australia remain gender blind. That gender blindness is harming women and children. It is harming women who have an alcohol or other drug-related problem. They deserve gender-sensitive, trauma-informed, and violence-informed alcohol and drug treatment. But if violence prevention advocates are actively contesting the gendered nature of alcohol-related violence and its contribution to family, domestic, and sexual violence, they are inadvertently reinforcing the status quo, the gender-blind nature of Australian approach to alcohol. And in doing so, we're not pulling that lever. And I think what Kym said at the opening of this webinar was so important. It's right there. The alcohol lever is right there. And when we pull it, violence against women and children goes down. Last week in Western Australia, the outcomes of grog bans in regional and remote communities was made public. And by controlling alcohol provision in those communities, alcohol-related domestic violence dropped by 42%. 42%. You know, these are the sorts of gains that we want to see in violence prevention. Alcohol's not a silver bullet. It's not going to solve the problem, but it's going to make a significant contribution if we are willing to pull that lever. Thanks.
Thank you, Michael. And thank you, Michael, for also, I guess, speaking about the role of alcohol companies and lobby groups in trying to divert attention from this issue and trying to undermine any policy change that happens in this space across the country. While our speakers get ready to rejoin us for a panel discussion, I just want to again thank each of our speakers for sharing your experience. I think that everyone who's here today can hear the commitment that everyone on the panel has to seeing real change, and the commitment to making sure that people's experiences are centred in driving this change and in understanding the role that alcohol plays in violence and how we can change this. I'd like the focus of the panel discussion to largely be on the types of solutions that we can try and implement, and we've heard a few of those across today. So we know a range of things about the connection between alcohol and gendered violence and violence against children. We know that when the accessibility and availability of alcohol increases, that violence increases, and this includes the density of outlets in trading hours. And as Kym said, accessibility and availability has gone through the roof now that every phone is a bottle shop. And we know that drinking is largely gendered, as Michael spoke about quite a bit, that men drink 2/3 of alcohol globally. And as Ingrid said, we need to think about it in this way in the relation to the ways that we think about policy solutions. We also know that alcohol marketing reinforces gender stereotypes, and with the nature of data-driven marketing, that alcohol companies target people who drink the most alcohol through hyper-targeted marketing. So Michael spoke about the rivers of gold that these alcohol companies have access to. You know, the biggest alcohol retailer in the country spent $75 million in 1 year on expanding their digital capability so that they could know as much about drinkers as possible. Some of these companies call people who drink the most their super consumers, and they want to reach the people, the 5% of people who drink 36% of the alcohol, and encourage them to drink more and more and more, thereby driving harm. We know that the rapid delivery of alcohol is associated with higher risk drinking, and we now know that people are served ads that you can't step out of or exclude yourself from, and are 2 clicks and 20 minutes away from having alcohol to people's doors, which is just a recipe for disaster for people who are already doing it tough. We also know that the social determinants impact on alcohol use and harms, and that policies that contribute to gender equity and economic security are also important parts of this solution. There are a range of measures that governments can do as part of a comprehensive approach to prevention. And we held an expert roundtable in Perth a couple of months ago, and there were 5 different areas where people identified that change was needed. So one, and just so importantly, is not just to say this, but to do this. We need to listen to women and children when they tell us that their partner or father is violent when they drink, and we need to understand their experiences and centre that. I have seen too often people's experiences being silenced, and this part of people's experiences being silenced. We need to name men's alcohol use when we're talking about violence prevention, and we need to challenge the forms of drinking that are tied to notions of masculinity. We need to acknowledge that when men view women as less and use alcohol, it makes things worse. But as Michael said, these cultural changes aren't enough. We need to be looking at system and legislative change. Our alcohol laws are outdated. They were developed 50 years ago. They have largely not changed, and they try to strike an impossible balance of increasing competition and minimising harms. So we need to update our alcohol laws to prioritise the prevention of all harm, include particularly violence against women and children, and we're heartened to hear the Prime Minister identify this as a priority and states and territories to commit to looking at this. We need to introduce common sense guardrails like not selling alcohol from bottle shops or via delivery after 10 p.m. We have a study from Boxar in New South Wales that shows that when trading hours for the delivery and sale of takeaway alcohol was extended from 10 p.m. to 11 p.m, that there was a statistically significant increase in violence reported to police that involved alcohol, which equated to 1,200 additional incidents over 3 years. I said this, and I've said this a couple of times to the New South Wales government, to sit there and have this information before you and not act, it makes me so sad, because how can you say that you're doing all you can to prevent violence and not act on information like that? We need a 2-hour safety pause between when alcohol is ordered and delivered, and we need lower strength alcohol at events that are higher risk and more alcohol-free settings. The third area is alcohol industry accountability. We need to name the companies who are actively halting changes to alcohol laws that will help to prevent violence against women and children, and we need to go directly to company boards and shareholders and show them how the tactics of these companies that they're engaging in are profiling, targeting and selling alcohol to people who drink at the highest levels are driving more harm. and we need our governments to hold these companies accountable for the harm that they cause. The fourth area is responsive and flexible government funding. We've heard a lot about the need for gendered services, and this is still a significant gap when it comes to alcohol and other drug treatment. We need funding for services that doesn't limit them to one sector or category, acknowledging that these issues are complex and go across alcohol and other drugs, mental health, women's and Aboriginal and Torres Strait Islander and family organisations. There are many services that are working to provide comprehensive approaches to violence prevention. They need to be adequately funded to do so. And we need advocacy funded independent of service delivery so that organisations feel free to speak their truth without feeling risk to their funding. And then the fifth area is increased service responses. So we need all services that people interact with, alcohol and other drug, women's, Aboriginal and Torres Strait Islander, family, community, general practice, to be well resourced and equipped to support people and meet them where they are at. So these are some of the general areas where we need action. And now I'm really keen to jump into a discussion. I can see that we have a lot of questions. So I want to go straight to the questions from the audience because, you know, we have 150 people here today. So the first question I'm going to flag is from Megan Harvey. And this is a question for Michael. So what is the driver of men's drinking behaviour and uptake? Is it social norms? Is it due to their own experience, trauma, intergenerational? Is it media who normalises men's drinking habits?
Yeah, I think it's a great question, Megan. I don't know if I've got the answer to that question because I think it is, I think it's so central. I think all of those factors that you've listed are at play. I think also my sense is that I think men on average are not as good at, let's say, emotional regulation than women. And so we often see men turning to alcohol, drugs, other sorts of activities, often sort of quite physical or sort of biological activities. That includes things like exercise in order to regulate our emotions, because I think men, for social, cultural reasons, don't always have good outlets around stress and anxiety. And an important part of particularly alcohol for men is around socialization as well. And so if we look at things like sport, which is a really important way in which men socialize, and then the extent to which the alcohol industry has its tendrils into the sporting codes, to the point where, you know, major sporting codes in Australia are heavily dependent on alcohol sponsorship. You start to get a sense of the ways in which sort of there's the social and the cultural, but then the economic and the political determinants of alcohol-related harm get quite entangled, and then can make violence prevention really complicated. So we've got 20 years now of sporting codes such as rugby and football trying to address male violence, including by players, and often that's by tackling the culture within the code. So often they'll bring in external consultants to deliver education programs, and that's in line with this focus on attitudes, and yet nobody seems willing to touch the fact that they are sponsored by the alcohol industry, and that has all of the flow-on effects that Kat has mentioned in terms of, you know, provision of alcohol at sporting events that are, you know, relatively high proof in terms of their alcohol content and what the flow-on effects for public safety are. So I've gone long on that question, Megan, but I think it's a really important one and one that we need to disentangle.
Thanks, Michael. I've got a question here from Narissa Carter, and I'm going to come to you first on this one, Nick. Narissa says, I'm currently living and employed in a dry community in Cape York. When alcohol was first banned many years ago, FV statistics reflected those recently shown in WA, and incidences significantly dropped. However, over time, slide grog has made its way into the community, and FV and assault statistics are now some of the highest in Queensland. If the complete banning of alcohol is no longer effective, what alternative approaches are there to minimise the impact of alcohol-related harm where theoretically it should not exist?
Yeah, and that's a really important question. And I touched on before the difference between imposed government alcohol restrictions versus self-determined ones, or community imposed self-restrictions. And Cape York is an example of one where they've been told to remove the alcohol. And so when it is imposed, it has quite it undermines the self-determination, which means it creates this impact of racism on the community. And when you are telling a community what to do, well, any human being, if you tell a human being exactly what they need to do, what are they going to do in response? They will resist. That is part of our human nature, is to resist these sorts of things. And that community there, in order to have their self-determination, they've introduced sly grogging. And so that is an example of where community haven't been listened to, community haven't been involved in developing the response to reducing alcohol, leading or governing those responses as well. If they had listened to that community and then resourced without managing those resources and telling them how to apply those resources, you would have a very different response. In fact, you would have a response similar to Fitzroy Valley, because it would be healing informed. It would be around what are the needs of the families that are impacted by violence and alcohol. And as Michael had alluded to, it's not just a simple case of removing grog from an area. The way in which it's removed and the things that accompany that removal, because you're removing something that for our community has been introduced as a way of life, coping with, very extreme trauma. What is going in place of that trauma? If you do not have support services, then see suicides go up because people don't know any other way to live. They have been completely broken. So again, that's probably a long way to say there is a difference between removing alcohol as determined by versus having imposed restrictions. And these are the outcomes that unfold from that.
Thanks, Nick. I've got a question, and this is a question for Ingrid. Did the women's partners engage in drugs and alcohol, or mainly alcohol? Interested to know if there was a combination of both.
Yes, thanks for the question. The majority was only alcohol. There were a few women whose partners were polydrug users. The other drugs were marijuana and heroin. What was interesting, the women whose partners were using other drugs did say that actually when the partner was using marijuana, it was actually safer for them. So they were really clear about, even where there was other drugs involved, they actually felt safer than when he drank alcohol. So they were very clear about that. Yeah.
Thanks
Can I
for
just
sharing?
Yeah. Can I just jump on the point that was made before, I think by Michael
Sure.
about that some of the drivers of men's alcohol use and violence. Just an interesting reflection from some of the women that are, well, the majority of the women, they could see that their partner was self-medicating, and they were trying to unpick what was kind of going on for their partner. And I think it's important that we also understand that, and again, in no way I'm not condoning violence at all, but one of the things is that the women are actually trying to do all they can to seek help for their partner. They're going off to visit the GPs. I mean, he's not doing that. They're doing everything they can because they can see that this is what's happening in their situations. They're also doing the work that governments are doing around alcohol, restricting alcohol availability. One woman told me about how when they were deciding where they were going to live, she mapped out the proximity of the alcohol outlets in every place that they were considering. And she deliberately chose ones that meant that he wouldn't have easy access to go out and get booze when he was on a bender. So look, women are doing all of this on their own, and they need the support from, in terms of alcohol, restricting alcohol availability from governments. They also need the help of services. So when they're going and asking about their partners, help for their partners drinking, they need to have those opportunities welcomed and the services provided.
Thanks, Ingrid. I think that this is a really important point. This is being done, but these women need governments to do this work so that it's not left on them to do it. Kym, I can see that you celebrated this comment with the clap emoji during Ingrid, and I just wanted to invite you to comment at this point as well.
Oh man, I'm so honoured to stand beside all of you today. This is an incredible conversation. And yes, I'm nodding furiously along with all of you. I completely agree. We need to have the backup, not just of government, but also of our medical profession, our GPs and people dealing with addiction as well, to understand that there is a correlation and to help back us up in that case. And like Michael said, there is a gendered element to alcohol abuse or misuse. And I'm not one to sit here and shame anybody, because I myself have been a victim of alcohol. What word will we use? Misuse, shall we? Self-medicating. So I completely empathise with what everybody is saying now. But silence is definitely consent. We need to start speaking on this more. And I have a question to pose to everybody. If you knew that a very practical solution, a really practical solution, bringing the delivery time down to 10 p.m. instead of 11 p.m., right? 1 hour, just a tiny little shift. If you knew there would be 1,200 less incidents of family violence, would you agree to that? And if you agree to that, I implore you to join us on this campaign and help us make that happen.
Thanks, Kym. And one of the questions here that I might just ask off the back of that is that it's been mentioned about Uber's delivery services bringing alcohol to people's houses. Is there a push for some kind of regulations in these services, and what could this look like? Did you want to elaborate on that a little more, Kym?
Yeah, absolutely. I think that's the starting point, and Kat and I are more than happy to go around to every state and territory and help every state and territory leader with their Liquor Control Reform Act reforms. We are more than happy to do that. I don't think it's a big ask at this point in time. I think that is more than reasonable to ask for that. And then a delay in the delivery, I think is also not unreasonable to us. Like Michael said, we've moved quickly. We've moved to heaven and earth when it comes to men experiencing alcohol-related violence. Yeah? Why can't we do the same now? It is quite ironic that children are allowed in nightclubs. Why? They're not allowed in pubs and clubs when people are heavily intoxicated. But what is happening now with alcohol home deliveries, we are expected to be the bouncers. We are expected to uphold the responsible service of alcohol within our own home. And that is completely and utterly unrealistic. There are times when children might be safer in a club when there are actually people in that environment who are capable of monitoring alcohol consumption.
Thanks, Kym. I think that this is, there's a couple of comments that are going around, alcohol is a drug and it is the most harmful drug. And I think that, we don't need to be convincing anyone in this panel of this in relation to the questions that are being flagged. I think that I am just seeing a million questions come in, but one of them, and I think this is a good opportunity to go around, is what do you think would be the single most impactful policy change? So I might start with you on this, Michael. around what you think would be the single most impactful policy change in this space?
If we could embed the prevention of family, domestic and sexual violence as a goal of liquor licensing at the state and territory level, if we could articulate that as one of the aims of liquor licensing, then I think that would be a huge win with multiple cascading effects across the many different areas of alcohol availability and marketing.
Thanks, Michael. Ingrid?
It's really hard to choose, but look, I think a whole-scale effort to reduce alcohol availability in all kind of walks of life, and I'm thinking sporting events and, you know, all of the things that you talked about, but really, as I said, women are doing this already. I just have some caution around increasing the price of alcohol when considering the economic impacts that actually can possibly have for women in some of these situations, as I talked about the economic abuse. But I think there needs to be much more thought that can go into around the price levers, but absolutely, without question, alcohol availability.
Thanks, Ingrid. And I think, you know, it's really important to reflect on the stories that you were sharing about women having to control that availability in the absence of governments doing that. Kym?
Yeah, I think we need to keep up, first of all, with the times and with the accessibility and the influx into the home. We cannot expect Uber delivery people to do a risk assessment at the front door. It is absurd. And what about the risk to them that they're put in that position? The other thing would be predatory marketing. When we know that family violence goes up on grand final night, when we know that the influx of alcohol into the home and gambling on that night, and yet we're still allowed to deliberately target and market a harmful product towards people on that night, which we all know is the most horrific night. Predatory marketing, I think, needs to be really addressed, and I think that's coming up with the Privacy Act on a federal level. But I think also just in general, guys, this conversation, you know, this conversation right now, the fact that we're able to talk about it, the fact that it's being recognised, finally, we can diversify and we can look at, you know, whatever levers we can pull right now, because that's what we need to do. So this conversation, I think, is the best starting point.
Thanks, Kym. Yeah, certainly on State of Origin night, when I saw the biggest alcohol retailer through one of their brands boast about how much their sales would go up that night through media releases, and another company put out maroon and blue branded bottles of their vodka branded lolly drinks, I just thought, how can this still happen when we know that connection, we know about the evidence? Nick?
I would say the best policy would be one that is informed by those with lived experience, as supported by those in research and policy making. I don't think we could possibly inform one well enough without that voice leading at the table. So, I mean, I wouldn't even try guess what would be the most effective policy, because I'm not someone that is that deeply affected and connected to it.
Thanks, Nick. I'd like to now just do one more whip around the room, because I'm conscious that we're down to our last 7 minutes, and I'd like to ask our speakers to leave their final parting thought with each of the people who've come today. I know that for many people who are part of this webinar, that this has been a conversation that people have wanted to have for a long time. So I want to make sure that people get the chance to leave one final thought, and then we'll wrap up today and we'll let you know how you can stay engaged and involved. So I might start with you again, Michael.
I think being able to just widen our understanding of the drivers of violence, to start to bring in that complexity. I mean, we've talked about alcohol today, but then we've also talked about trauma. We've talked about how alcohol and trauma intersect in ways that then contribute to violence. You know, this is the way that violence really gets its teeth into our communities and becomes really difficult to separate ourselves from them. One of the things I've really appreciated about this morning is that point about the broader opportunities to start to draw pressure and heat away through things like GPs, through things like alcohol and drug services. You know, there are so many opportunities. There are so many people who are in contact with circumstances where violence has taken place or at risk of taking place. And if we're able to empower, say, GPs, for instance, if we're able to empower alcohol and drug services in order to start doing work adjacent to family violence, then all of that burden, that pressure that sits on victims and survivors and their kids at the moment, because when government and professionals don't do their jobs, you know, that burden does go somewhere. And basically it goes into the home. It becomes the responsibility of kids and women to manage risk if we're not prepared to do it. So I think it's just been a really great conversation in terms of just starting to open that complexity back up, because with that comes a lot of different opportunities to transform sometimes what has seen as an impossible task.
Thanks, Michael. Nick?
So, the main thing would be building on what Michael said, to think about it in the context of healing, that there are many people like those that are perpetrating violence have learned that violence as well. And as Ingrid and Kym have touched on, have also, you know, they've experienced violence themselves and are drinking, obviously, to soothe, you know, something, you know, for themselves, and then it becomes externalized. So what are the needs, you know, and how do we have the space and grace without the influence of the alcohol industry to process, you know, what's really happening and what those needs are, what that healing needs are for different families. But we can't do that without the space from alcohol, you know, industry's influence and how it's insidiously embedded into the Australian culture. And this is largely, I think, one of the biggest problems we have, is that it's part of the Australian identity, and they've been very clever with that marketing, because as soon as you don't drink, all of a sudden people are fearful of you in some way. People shame you because you're not participating in some form in that social group. And that's a very interesting and very clever way to create a culture of drinking. That in order to belong to that culture, you need to consume alcohol. I think we need to expose that sort of thing, because that's what the people, the decision makers that are making the policies, that's them. They're the ones that are also making these decisions. Oh, I think I dropped out there.
We can hear you, Nick.
So yeah, they're the ones. Oh, you can hear me? Okay, cool. Yeah. So the decision makers and the politicians, the ones that also alcohol as part of their culture, they're the ones making these decisions. And I think it's too much power, and we're not able to access the healing that Australia needs in order to address the violence.
Thanks, Nick. And we've certainly seen a theme through questions that are being asked and comments being posed about that industry influence there. Ingrid?
I think I'd like to see that we can dismantle some of the discomfort around talking about alcohol as a risk factor, because we just stop there. It's become a barrier for any kind of meaningful intervention that can actually change people's lives, absolutely change people's lives. So I would just really want us to kind of reflect on what are these barriers to even having a discussion about women and children's lived experience of their partner, their father's drinking and violence. So it's time to stop now. It's really time to just hear women and children and work towards making them safe. That's it for me.
Thanks, Ingrid. And I just think it's so important that we're able to freely discuss all of these things and to seek to understand. So, because we're all working towards the same goal here. Kym, I really wanted to leave the final word to you, mate.
Oh, Lord, no pressure. Yeah, Kat, you constantly inspire me in terms of being solution-led. It's very easy for us to put our weight behind what we believe in, but at the end of the day, we're not siloed. We can't achieve this individually. We have to do it together. And I'm grateful that we've had this discussion today. We have to dismantle that discomfort. And my other thing is this. I've been doing a lot of kind of research projects lately, and I've, been a victim survivor on many consultations over the last 5 to 6 years. And I'm sick to death of asking victim survivors the same questions. It's becoming almost a secondary system abuse by mining victim survivors for their input based on their trauma. We've told you. It's been said. We know this causes harm. There's been enough data collection, enough research. We know the facts. It is now time for action. And there are some very simple actions that we can take right here and now that will help people.
Thanks, Kym. I think that is a great message to leave with today. We have a range of measures that can be implemented. We have lots of information on this. We know the types of things that are being put up and pushed back. We need governments to do this now and to move forward. I want to thank our speakers, Kym, Ingrid, Nick and Michael, for joining us today. Not only are these wonderful humans incredibly intelligent and insightful, but I feel really lucky to call each of you friends as well. I think you're all fantastic. So thank you so much for being part of today's webinar. I've dropped my email in the chat, and I dropped my email in the chat because I want you to reach out. And I want you to email me with any thoughts, stories, reflections. I know there are lots of comments and questions that were unanswered today. And as Kym said, for us, this is an ongoing piece of work for as long as we need to do this to get the change that we need to make sure that people are healthy, safe and well. If you're wanting to find out more about FAIR or other ways to get involved, then please visit our website at fair.org.au. Our community is so important to the work that we do. I 100% believe that we are here to serve the community. And so we want to hear from you. We want to have the conversations, the comfortable and uncomfortable conversations. We want to hear all the things so that we can drive the change that we need to drive. FAIR is working on a framework at the moment on the prevention of gender-based violence and violence against children. I've got here that we'll be sharing this by the end of the year, and that's because it will take as long as it takes in terms of us needing to make sure that we're engaging with people to inform that work and to make sure that we're communicating that in the best possible way. And I guess that I just want to thank you all for coming along today. It wasn't very long ago that this conversation wouldn't have been possible, and we certainly wouldn't have had more than 150 people to come here to listen. So thank you for coming. Thank you for listening. Thank you for sharing. I'm very, very grateful for you taking this time today to be part of this. See you later.